Melatonin can have amazing benefits for reflux. That's gastric reflux. And of course, a condition called LPR, laryngopharyngeal reflux, something called silent reflux, where people go, they're constantly clearing out their nose and their throat, get blocked or infected ears, and lots of upper nose and respiratory throat problems associated with it. And melatonin, which you probably are aware of, is often called the sleep neurohormone, but it has 1,001 other benefits, particularly in the digestive tract. So hang in there just a few minutes and I'll explain why and show you why. And what we do know is that LPR and reflux are caused literally by the refluxate coming up from your stomach, hydrochloric acid and pepsin. Pepsin's the digestive enzyme that breaks down proteins and so on. And sometimes bile from your small intestine makes it all the way through the stomach and back up. And so you get literally these conditions. That leads to oxidation and inflammation. But in addition, you also end up with a lot of pain, suffering and discomfort, which everyone's aware, but a whole raft of these other conditions associated with reflux. Things like esophageal problems, esophageal cancer, something called Barrett's esophagus, esophagitis, inflammation of the esophageal area, respiratory problems, including things like chronic obstructive pulmonary disease, allergic conditions like skin dermatitis, asthma as well. All of these conditions are linked with reflux and LPR. And you're going, I wonder why. Then you've got even mental health problems such as anxiety. No, the reflux isn't causing it. It's actually linked as what's called a comorbidity. Poor sleep and even some cancers are associated with this. And it comes back to understanding a little bit about reflux and also what you can do using melatonin to benefit it. So at the end of the day, what we do know is diet and lifestyle are the two major factors, and occasionally disease might be Helicobacter pylori. That's a nasty little bacteria you can get in the stomach and causes ulcers and so on. But primarily diet and lifestyle lead to problems with emptying of the stomach. It sits there. And I've got lots and lots of videos on stomach health and gut health, so check those out as well. So it sits there in the stomach and you've got this lower esophageal sphincter. This is a muscle at the top of your stomach, and that holds everything down. And when that's not functioning properly, probably because of abuse from overeating, the wrong type of foods and the wrong type of lifestyle, some gets through and the hydrochloric acid, pepsin and bile gets into the esophagus and causes this. So where does melatonin come into it? Well, first and foremost, just a little bit of background. What we do know is if you've got reflux, okay, you have a 200% increased risk of sleep disorders. This is all types of sleep disorders. And you're thinking, hold on, what's that got to do with it? Well, remember, melatonin is the sleep neurotransmitter. And what they find that if you've got reflux, you have lower levels of melatonin. So increased reflux leads to decrease in melatonin levels in the blood. So they can measure it in the blood, they can measure it in the saliva, measure it in lots of parts of the body. And so there's this link, this inverse link. The higher the reflux, the worse the reflux, the lower the melatonin levels, and then obviously maybe even some sleep problems too. Well, we'll talk about that as we go. A decreased melatonin is also linked with upper respiratory problems, tract disorders, ulcers, and Barrett's esophagus, which is precancerous cells in the esophagus, inflammation of the esophagus and so on. So this is where melatonin comes in. First of all, there are binding sites of melatonin throughout the whole digestive tract. It's not just the produced in the pineal gland melatonin and it goes to make you drowsy at nighttime. It's actually produced in all your active cells as a potent antioxidant, anti-inflammatory, and a messenger chemical. And so there are these binding sites throughout the gut. So when the melatonin, for example, in your saliva gets down there, it sends off messages. It also acts as an antioxidant, anti-inflammatory. Yeah, and your cells all the way along are producing it, and it's going to these binding sites. So you find it in saliva, you find it in gut cells, all your gut cells, 100 times more than a concentration that you would find in the blood. So why is it at such high concentrations in the digestive tract, higher concentrations in the blood, and wow, maybe it's got something to do with digestive health. You're on the right track there. And you find that if you fast, it decreases the levels of melatonin. And of course, when you eat, it increases the level of melatonin. Now, the final link I want to put together here, part of this equation, before I show you how to work with melatonin, is that melatonin levels are also associated with all of these conditions as well. And we find that melatonin has been used in treatment of all of these conditions. So you can see already we're dealing with fixing the underlying problem, not just treating the symptoms. So when you supplement with melatonin, and the usual doses in the experiments are 3 to 6 milligrams, although there are experiments with a lot higher because of the huge safety profile. It is extremely safe. Remember, our body produces it, so it's extremely safe. So what we know is melatonin is absorbed in the gut. All the way down, it's absorbed. However, on the way down, it starts to repair any damaged cell. So if you've had reflux and you've had some pepsin and hydrochloric acid, maybe a bit of bile burning and causing damage along your esophagus or in your stomach or any other place, then it starts to repair those. And there have been studies where they've done alcohol damage, damage from non-steroidal anti-inflammatory drugs, and also other poisons where they've poisoned the rats, put these chemicals in the rats, and melatonin helps repair it. So in terms of reducing the amount of inflammation in the esophagus, like esophagitis or Barrett's esophagus, it dramatically reduces that inflammation and helps with repair. So it strengthens that esophageal lining. What also that means is that toxins produced by bacteria all the way through your gut can't get through into the blood and go around and cause all those other conditions. Remember the other conditions we were talking about, everything from mental health and sleep disorders right through to cardiovascular. All of those conditions are linked to chemicals sneaking through the gut wall, something called leaky gut. And this strengthens the esophageal layer and the layer in the stomach and all through the large intestine and so on, small intestine, to prevent that leaky gut. In rats, it decreases the lesions and the damage caused by them. And also, we know melatonin is effective because when they block the melatonin receptors, something called the M2 receptor, the ones that lock onto the melatonin and start doing all their good things, when they block those receptors, it stops healing. So these melatonin receptors and melatonin are essential for healing all the way down the digestive tract. Now, the great thing is you can leave it in your mouth a little bit. When you literally swallow it all the way down, it's doing some benefit to you, which is absolutely great. Now, when it comes to human trials on reflux, there aren't that many human trials, but the ones that have been done are extremely effective. In fact, they've outperformed proton pump inhibitors. Now, proton pump inhibitors are the ones that they give people to stop the formation of acid in the stomach. And you need acid in the stomach. Please watch my other videos on healthy digestion and reflux. And you'll see I've already mentioned melatonin in them, as well as lots of other things you can do as well. It's a win-win situation. Lots of good information in those videos, and subscribe to the channel so you get all these updates that I put up. So in one study where they had 78 patients with reflux, melatonin and PPIs outperformed the PPIs. So they outperformed the drugs when melatonin was added onto it. And you're thinking, well, that's just when it's added on. That was a 2023 study. There was another one done earlier. So on all accounts, it shows to help benefit when you take these proton pump inhibitor drugs. However, the most definitive study done almost 18 years ago was 175 patients who literally got melatonin, tryptophan, which is the precursor to melatonin. Your body changes tryptophan into melatonin. So that means it's going to work a little bit further down the system because it converted, added, changed, altered into melatonin. B6, folic acid, B12, methionine, and betaine. And remember, they used concentration of melatonin between 3 and 6 milligrams. 40 days, and this was done back in 2006. You got your B vitamins, a couple of amino acids there, and it was 100% effective with no side effects, no negative side effects. In fact, it has lots and lots of positive side effects I'll mention in just a moment. So that was the most definitive study. Now, since then, there's been lots and lots of case studies where individuals had recurring reflux, had been on the PPIs, 2 months later, came back because you're not dealing with the underlying conditions and causes. And so giving the patients 3 milligrams, 6 milligrams on all of these case studies demonstrated benefits. Now, on the PPIs, it was only 65% effective. And again, no side effects. Helicobacter generated dyspepsia. Helicobacter is the one I've already mentioned that gets into the gut and can cause lots of issues like ulcers, and dyspepsia is one of those conditions. And this was a study of postmenopausal women, and they found it extremely effective in controlling the dyspepsia and in actually controlling Helicobacter, because it's actually helping set the body back to where it can get into the healing, and it helps heal the ulcer in the process. So what we know is melatonin is multi-therapeutic. In other words, it doesn't just help with the reflux or the dyspepsia. It helps with all those other conditions associated with it. And in the process, it doesn't just stop it, it helps speed up the healing process. So it's a fantastic thing. And so what we've got, instead of the negative side effects, we've got lots and lots of positive side effects. If you like this video, make sure you subscribe to my channel. We've got lots of information on gut health, and share this with your friends.